They say real estate is all about location, location, location. And so is public health. Whether it's your risk of getting sick, your access to clean water, or how quickly you can get care in emergency events. A lot of that depends on where you are. AI is making a dramatic impact on improving public health. But the problem we face today is that most of today's AI models don't fully understand location. They can analyze text, generate images, summarize text, even hold conversations. But they're not built to interpret the environmental and geographic context behind a disease outbreak or a health disparity. That's where geospatial foundation models come in. These new AI systems are trained on Earth observation data, like satellite imagery or climate indicators, as well as other geospatial datasets like population density. And they're beginning to help us answer questions like, where are the most people at risk? How are disease patterns shifting? What interventions will have the most significant impact? I want to walk you through what these models are, how they're trained, and how they're already being utilized in real-world public health and sustainability efforts. I'll also provide some use cases from my own work that align with this growing field. And importantly, I'll talk about what these models are not, including the limitations and challenges we still need to overcome to truly unlock their potential for local decision-making. Let's start with some background. You've probably heard of foundation models like GPT or DALL-E. These are large AI systems trained on vast amounts of data, usually text or images, enabling them to perform multiple tasks. Geospatial foundation models are based on the same idea, but they're trained on geospatial data. So satellite imagery, land cover maps, climate reanalysis, elevation models, night lights, population grids, and much more. Instead of teaching the AI to predict the next word in a sentence, we might teach it to fill in missing satellite pixels that are under clouds, or identify land use patterns, or forecast air quality. These models have learned deep representations of the Earth's surface, the oceans, the atmosphere, which we can then adapt to address various public health issues. Now, some key examples. Prithvi from NASA and IBM is an open source model trained on petabytes of multispectral Landsat and Sentinel-2 imagery. It has already been adapted for drought detection, agriculture, and increasingly for health applications. Aurora is Microsoft's foundation model for Earth systems forecasting, delivering fast, high-resolution predictions of weather, air quality, and ocean conditions. Clay is another open-source model that turns satellite images into compact, meaningful embeddings for rapid environmental monitoring, change detection, and geospatial analysis at scale. Google's Alpha Earth is one of the most exciting developments in AI for Earth analytics. It combines generative AI with powerful foundation models and leverages Google's unmatched access to vast and diverse geospatial datasets to deliver real-time insights like flood detection and infrastructure damage assessment. Environmental and social determinants like temperature, rainfall, land use, pollution, infrastructure, and urban heat island effects. These all play a significant role in shaping public health. Traditional surveillance systems often fail to capture these variables effectively, particularly in regions with limited resources. But satellites can. And when you combine satellite data with machine learning models trained to detect patterns, you unlock a powerful tool for early warnings and smarter interventions. In one of my past projects with the World Health Organization, we applied machine learning to integrate routine disease case data with environmental indicators such as temperature, rainfall, vegetation indices, and of course, population density, demographics. This approach allowed us to predict where disease outbreaks were likely to occur next across Africa. The models we built could generate weekly forecasts at the district level across most of the continent. We were able to flag high-risk areas before outbreaks peaked, giving public health teams a valuable window to act early. Now, this was before most geospatial foundation models. With geospatial foundation models, We have an opportunity to take this kind of work to the next level. By fine-tuning large pre-trained models on specific health challenges or local regions, we can reduce the need to train every model from scratch. This could drastically speed up development, improve accuracy, and make scalable, location-aware disease forecasting even more accessible. One of the most exciting recent developments is the emergence of multimodal AI models that combine text, imagery, structured data, even sensor reading. Aurora is a great example. And it's also why I'm really excited about Google's Alpha Earth and their idea of geospatial reasoning. They ingest satellite images, weather data, and language descriptions to understand complex Earth systems. This multimodal approach is key to public health because health crises don't happen in a vacuum. Let's say there's a dengue outbreak. Rising temperatures, poor waste management, and stagnant water in informal sediments might trigger it. A model that can process satellite imagery, government policy texts, census records, and environmental variables simultaneously enables decision makers to identify the root causes and create practical solutions. In a project I'll be supporting in the Gulf region, we will explore how these models can help manage urban environments more sustainably. This work may involve identifying zones of extreme heat exposure, mapping air pollution corridors, and managing waste, all of which have measurable impacts on both physical and mental health. The same AI infrastructure could be repurposed to guide pandemic response or climate resilience planning. Digital twins are another frontier where foundation models are making an impact. A digital twin is a dynamic, virtual representation of a real-world system, like a city, a hospital network, or even an entire country's public health infrastructure. By fusing near real-time data from satellites, ground sensors, climate models, and health records, digital twins enable decision makers to simulate various scenarios and make informed decisions. What if a heat wave hits next week? What if vaccination rates drop in this neighborhood? What if we install new solar-powered water pumps in drought-affected regions? In other words, digital twins powered by AI don't just show you what's happening. They help you test what could happen. They allow proactive planning and stress testing of policies before they were implemented. For example, Microsoft's Planetary Computer or Google Earth Engine can enable climate and health researchers to build environmental digital twins that scale globally. New tools such as GraphCast from Google DeepMind are delivering world-class forecasts using graph neural networks and Earth system simulations. These applications are where geospatial foundation models can have their most significant long-term impact, powering these dynamic systems that help us navigate uncertainty. While geospatial foundation models like Clay, Aurora, and Prithvi represent a giant leap forward, they're not magic. They don't produce ready-to-use maps or health risk alerts straight out of the box. They output embeddings, which are intermediate representations that require additional fine-tuning or interpretation. And although we've made progress, most lack native multimodal fusion, meaning they struggle to integrate satellite imagery with, for example, tabular health records, mobility data, or text-based sources in a seamless way. Moreover, training and running these models can require considerable computational power, especially for fine-tuning on large regional datasets or the globe. Finally, despite rapid progress, many foundation models are still trained on limited types of sensors, resolutions, or geographic regions, which can impact their generalizability for local or domain-specific applications. Let's take just one 10-meter by 10-meter pixel on the ground. This is the spatial resolution of most satellite imagery these models are trained on, and by extension, the foundation models themselves. In this area, with essentially one value in the imagery to represent it, consider the vast amounts of human activity, infrastructure, or health-related context that will be missed. And yet, that overlooked detail could be precisely what your analysis needs. I'll walk you through how a city-focused public health team or a sustainability planner might actually use a geospatial foundation model to address urban heat. First, you'd start by clearly framing your problem. For example, predicting which neighborhoods are most vulnerable to dangerously high surface temperatures during heat waves. Solving this challenge is beneficial when trying to prioritize where to plant trees, what urban surfaces we need to modify, or allocate cooling infrastructure such as shaded bus stops or public water stations. Next, you gather your data. You'd use satellite imagery such as Sentinel-2 for optical data, visual data, or Landsat's thermal bands to estimate surface temperature. You can consider incorporating nighttime light data to assess built-up areas and adding layers such as population density, green space coverage, and impervious surface maps. The beauty of using foundation models like Prithvi or Clay is that they are already pre-trained on this type of Earth observation data across millions of patches, so they've essentially seen cities in many forms and conditions. Then you can fine-tune the model with local ground truth labels, such as those from weather stations, mobile temperature sensors, or thermal drone surveys. Now, you don't need to train the entire model from scratch. Instead, you extract embeddings from the pre-trained foundation model and feed them into a small neural network or a linear regression layer that you train on your task-specific data. This transfer machine learning process. So transferring the knowledge from the foundation model to your custom model is computationally much lighter than teaching a complete model from scratch. But you still benefit from the broad generalizability of the foundation model. For hardware, you'll want access to a GPU. An NVIDIA A100 or similar is ideal for fine-tuning. Or of course, if you got more, go with it. However, even consumer-grade GPUs such as RTX 3080 is adequate. Or you can use cloud services like Google Colab, AWS SageMaker, or Microsoft Azure can accomplish the task for moderately sized urban projects. Training time typically ranges from a few minutes to a couple of hours to days, depending on the size of your dataset, the model architecture, and of course, your computational power. Once the model is trained, you use it to generate predictions across the entire urban area. It's important to note that while model training times can be long, inferences or predictions can often be done in fractions of a second. These predictions can be visualized as heat maps, which show which areas are expected to be hottest on specific days or during particular seasons. Even better, you can simulate what-if scenarios. What if the city added 10% more tree cover in one district? What if a planned development removed a critical green corridor? These simulations help city planners and public health officials make more informed decisions more quickly. Finally, these results can be integrated into decision support dashboards using tools like Dash or Leaflet. You can even automate weekly updates by rerunning predictions with the latest satellite data, turning your model into a living, continuously updating system for managing urban heat risks. To be realistic, we're still in the early stages of this journey with geospatial foundation models. Building a robust, equitable, and accountable AI system for public health isn't just a technical challenge. It's also about governance, data sharing, interdisciplinary collaboration, and trust. We need better ground truth data for training and validation. There is a need for more open source models that can be adapted to local contexts. Additionally, stronger partnerships between the public health institutions and tech professionals is critical. And of course, furthering ongoing conversations about ethics, bias, and transparency. One significant step forward, which I really appreciate, is NASA's push to release open geospatial foundation models, such as Prithvi, to the public. Another is the work of organizations like Radiant Earth, which are actively working to benchmark and test these models on real-world use cases, including those relevant to the global south. Evaluating these models is far from a straightforward task in itself, since each model likely has its own strengths applicable to individual use cases and applications we haven't even thought of yet. As someone who works at the intersection of AI, geospatial data, and public health, I'm excited. Not because the technology is perfect, but because we finally have the building blocks to make public health more responsive, more precise, and more preventative. Public health has always been about more than medicine. It's about clean air, safe water, food security, housing, climate, mobility, equity, and yes, definitely location. Now that we have AI that can understand all of that, let's use it. Thank you so much.